Award to Dr. Tedros.
Dear graduates, faculty, members of the Rectorate, and esteemed guests, following the recommendation of the faculty, the University of Nicosia has conferred the degree of Doctor of Science Medicine, honoris causa, to Dr. Tedros Adhanom Ghebreyesus in recognition of his exemplary leadership and contributions to global health that have been nothing short of extraordinary. Dr. Ghebreyesus, serving as the Director General of the World Health Organization since 2017, has steered the organization through a series of critical initiatives and responses to global health challenges, including the COVID-19 pandemic and the Ebola outbreaks. During his tenure, Dr. Ghebreyesus has been a beacon of leadership, prioritizing transparency, inclusivity, evidence-based decision-making, and social justice. During the COVID-19 pandemic, Dr. Ghebreyesus was a tireless advocate for a unified global response. His leadership has been instrumental in coordinating international efforts to combat the virus, from promoting equitable access to vaccines through the COVAX initiative to providing guidance and support to countries navigating the complexities of the pandemic. His decisions and actions underscore his commitment to health equity through meaningfully addressing disparities between high and low income countries. Even beyond the pandemic, under Dr. Ghebreyesus' leadership, the WHO has strengthened its focus on global health security, ensuring that countries are better prepared to prevent, detect, and respond to health emergencies, including efforts to improve surveillance systems, enhance laboratory capabilities, and support rapid response teams. Dr. Ghebreyesus has been a vocal proponent of universal health coverage, emphasizing that health is a fundamental human right and inspiring nations to ensure access to essential services without the risk of financial hardship. He has been a loyal advocate for vulnerable populations, promoting gender equality and combating health-related stigma. His tenure as Ethiopia's Minister of Health from 2005 to 2012 saw significant health sector reforms, including the deployment of health extension workers to provide essential health services in rural areas, the application of comprehensive malaria control program, and the expansion, treatment, and prevention services for HIV/AIDS and tuberculosis. These initiatives effectively reduced child and maternal mortality rates and led to a significant reduction in malarial deaths. Dr. Ghebreyesus' academic credentials include a doctorate in community health and a master's in immunology of infectious diseases, and thus enhancing the understanding of global health challenges. The conferment of this honorary degree highlights Dr. Ghebreyesus' visionary leadership, dedication to health equity, and transformative impact on global health. His achievements serve as an inspiration to the medical and public health communities and embody the values upheld by the University of Nicosia. Dear Rector and Dean, dear Dr. Tedros, could you please approach the stage? Rector, I request by the authority of the Senate, you admit Tedros Adhanom Ghebreyesus to the degree of Doctor of Science, Medicine, honoris causa.
Kalispera. As has been said, I did my master's in the University of London. So with some of you, I share the University of London. And after I applied, I think one of the professors, my supervisor, thought that I was from Greece, because my name ends with S, Tedros E Ghebreyesus. So anything that ends with S, so you can do it from Greece, it could be from Cyprus. But as you know, Ethiopia, Greece, and Cyprus, we have religion and also culture that links us. So that's why the names are very similar. Honorable Minister Michalis Damianos, Rector Professor Philippos Puyutas, Dean Professor Adonis Ioannidis, Vice Chancellor Professor Jenny Haim, and my fellow honorary doctorate recipient Panos Englesos, Dr. Evangelia Yanaki, Professor Andreas Karalambos, distinguished guests, ambassadors, excellencies, dear graduates, faculty, family, and friends. Again, Kalispera and Ime F. Charistimenos. It's a great honor for me to be here. First, to receive this honorary degree, which I accept with a mixture of pride and humility. And second, to celebrate with all of you today's graduates as you embark on your careers in medicine, public health, and research. My warmest congratulations to you, to your families, to your professors and mentors, and also to all members or family of the university, including the administration. You have so much to be proud of today. This is not come easy. This has not come easy. Your education occurred during the worst pandemic in a century. You and your families and communities had to endure a lot. And that put you in solidarity with the rest of the world. So while it was difficult, remember that it was also a truly exceptional moment. You were part of history. You were first-hand witnesses to the power of a pandemic. And that means that you're graduating not only as health and medical practitioners, but that you have been on the other side during a public health crisis. You have not only seen, but felt the impact of a global health emergency and its effects on families, communities, economies, and societies. It's an invaluable lesson, and one that I hope makes you not only a wiser health practitioner, but a humbler one as well. And while the pandemic crisis has now thankfully receded, you're graduating at a difficult time in the world with immense geopolitical challenges. But as you will see, in the world of public health, in aspects both predictable and unexpected, it's always a difficult time. And remember that even as you graduate today, your work as a student is not really over. Now you have graduated from being a student in school to being a student in life. Remember that the people and the communities you're serving or that you're working with often have a lot to teach you. And you should be humble to continue to learn. The world needs your attention and your expertise. And most of all, your commitment to listening and making the world a better place. This is actually my first visit to Cyprus, which you may not know is home to the newest of the World Health Organization's 153 country offices. Our office in Larnaca was opened less than 18 months ago and is led by Dr. Irshad Sheikh, who is here with us today. As we are in every country, WHO is committed to supporting the government of Cyprus in any way we can to promote, provide, and protect the health of the people of this island. Just a few weeks ago, Minister Damianos and health officials from the 11 smallest countries in Europe met here in Cyprus to commit working together on a range of common health issues. Like many of those countries, Cyprus faces a significant burden of non-communicable diseases, driven by tobacco and alcohol use, insufficient physical activity, and unhealthy diets. Climate change is also fueling the spread of mosquito-borne infections, including dengue, chikungunya, and Zika. And yet, like many other small countries, Cyprus faces challenges in attracting and retaining sufficient numbers of health and care workers to meet these challenges. But I'm impressed to see that Cyprus is doing something about that. I was amazed to learn that until 14 years ago, Cyprus did not have any of its own medical schools, but that now it has 3. This is very impressive and very encouraging, especially to see the range of careers for which this school is producing graduates, from clinical practice to public health and research. The simple truth is that there is no health without health and care workers. Certainly, artificial intelligence and other technologies offer huge potential for research and for diagnosis, treatment, and service delivery. One of our priorities at WHO is supporting countries to harness the power of technology for health. But as Jane Hyman said earlier, and I think other speakers as well, but nothing will ever replace a health worker. The COVID-19 pandemic showed us just how important they are. And yet globally, we're facing a shortage of 10 million health and care workers to achieve the health-related targets in the Sustainable Development Goals by 2030. Unsurprisingly, the biggest gaps are in the poorest countries, and WHO is supporting countries to address these gaps. And I hope you will have a contribution to address these challenges. I'm also pleased to see the school's emphasis on research, which has always been the engine of improvements in health. The key challenge we face is to ensure that the fruits of research are available to all people, that they serve to narrow inequalities rather than widen them. The COVID-19 pandemic was a perfect example. The development and approval of multiple safe and effective vaccines in less than a year was a triumph for science and research. But as you know, inequitable access to those vaccines globally was a stain on our collective conscience. This should not be repeated. At the World Health Assembly in Geneva last month, the nations of the world took decisive steps towards making the world safer and more equitable. Based on lessons learned from the pandemic, they adopted an important set of amendments to the international health regulations, the instrument of international law that governs the global response to health emergencies. Initially, countries had committed to finalizing the pandemic agreement or pandemic treaty, a landmark accord to make the world safer and fairer, in time for the Health Assembly. And although they came a long way, they were not able to reach consensus in time, as you know. The 2-year time frame they gave themselves was extremely ambitious. The fact that they came as close as they did in just 2 years is frankly incredible. Because as you know, international agreements take laws and take many, many years. If they complete negotiations this year or by next May, at the latest, as agreed, it would still be a giant achievement in very short time. They have committed to doing that for 2 reasons. First, because they believe they can and will reach agreement. And second, because they believe the pandemic agreement is still needed urgently, because history teaches us that the next pandemic is a matter of when and not if. However, the negotiations have been undermined by a torrent of mis and disinformation, including false claims that nations will cede sovereignty to WHO, which is not true. So I ask all of you to speak up for the pandemic agreement and to speak out against mis and disinformation, because this agreement belongs to you, belongs to all of us. It's about making the world safer, the world equitable for everyone. Dear friends, WHO was founded 76 years ago in 1948 as the world emerged from the devastation of the Second World War. Like the United Nations, of which we are part, WHO was born of the recognition that the only alternative to global conflict was global cooperation. Our Constitution was the first instrument of international law to affirm that the highest attainable standard of health is a fundamental right for all people without distinction. A fundamental human right. A fundamental human right, an end in itself. But at the same time, a means to development. Not a privilege for some or for most, it's a right for all. That's the right for which WHO will continue to work. My colleagues and friends and dear graduates, as you leave school with your degrees, you're entering into a world that faces many challenges: geopolitical, environmental, climate change, socio-economic, and so on. We're one humanity, and we must address these shared global threats with a shared response. There is a famous Ethiopian proverb that says, when webs unite, they can tie up a lion. When we work together, we can overcome anything. Equity, solidarity, humanity, and compassion are the qualities that can get us through. And I hope that you will carry those values with you throughout your careers and your lives. And remember that success comes in many forms. But most of all, for those of us in the health profession, it comes from helping others and helping to make the world a better place. F. Caristo Porapoli. I thank you once again for this great honor. Thank you so much. Thank you.